Short cervix or incompetent cervix during pregnancy. Let us discuss all about this in this video. Hi, this is Dr. Abinaya Vijayakumar, your doctor and post-pregnancy expert. For those of you watching me for the first time, I take post-pregnancy classes to pregnant women where I teach them how to stay positive and confident throughout their pregnancy and to connect with the child in the womb using simplified gut sanskar technique. I have trained more than 2000 plus women and I have testimonials of more than 100 plus happy mothers. To know more about the course, check the Tagmango link provided in the description or you can reach out to me on Instagram. My Instagram ID is mommy with bigger dreams. With no further delay, let's jump into the video. What is cervix and what is this incompetent cervix or short cervix? First and foremost, cervix is nothing but a funnel-like structure which is present near the mouth of the uterus. The cervix has two parts, one is internal os and second is external os. The distance between the internal and external os is called the cervical length. I will provide the reference image here so that you know what I am talking about. Normally the length of the cervix will be more than 3 centimeters. It will be around 3.5 to 4.5 centimeters. During pregnancy, the uterus which was just your fist size is going to expand like 1000 times or 2000 times more. Imagine this with that of blowing a balloon. So as and when you blow the balloon, the stalk gets shorter and shorter. Similarly, the cervical length is also prone to reduce during pregnancy. That is the reason we will be checking on the cervix length on every scan whenever we do. Usually the cervical length has to remain at around 3 centimeters in a normal pregnancy. But in few pregnant women, it can further reduce where it goes less than 3 centimeters. As and when the cervix length gets shortened, the capacity of the cervix to hold the weight of the uterus goes down, which means the cervix can open up anytime, leading to termination of pregnancy or preterm labor. So what should you do? Whenever we see that the cervix length goes less than 3 centimeters, the doctor would advise the pregnant women to have an adequate bed rest, to avoid lifting of heavy weights, to avoid traveling, to avoid sexual intercourse, to be on the safer side. But if the length is borderline somewhere around 2.5 centimeters, then the doctor would advise the pregnant women to undergo cervical encirclage, which is nothing but stitching up of the cervix as early as 12 or 14 weeks. As the name suggests, they suture up the cervix such that it holds tight and it does not open up even though the length is short. But having said this, even the post procedure, the women would be advised to avoid traveling, to avoid sitting on the floor, to avoid sexual intercourse, to avoid climbing steps, etc. This is advised prophylactically so that it doesn't increase the pressure in the pelvic region so that the suture does not open up. Next, if you ask me, is there any medications to increase the cervical length? Is there any exercise to increase the cervical length? Unfortunately, no. There is no such magical pill or exercise which can increase the cervical length. The cervix length either maintains the same or it can further reduce. We need to follow it up in every scan. All these activities like climbing stairs or sitting up on the floor, sexual intercourse, traveling, this can increase the pressure of the pelvic region, thereby leading to opening of the cervix and termination of pregnancy. The next question that I keep getting from many of the mothers is, if I had cervical encirclage, that is stitching up of the cervix during my first pregnancy, should I undergo the same procedure even the second time? Mostly it is yes, because it is your cervix, your uterus, which is going to be the same throughout your lifetime. So first time if the length of the cervix was short, next time also you will be advised cervical encirclage prophylactically even more in the earlier weeks so that to avoid any miscarriages. I hope you found this video useful. Do give me a thumbs up if you love this video. Comment below your doubts about short cervix or incompetent cervix. I will revert back at the earliest, and also share this with another pregnant woman who has a short cervix so that she knows what she is going through. If you're new to my channel, kindly take 1 minute of your precious time and subscribe to my channel and press on that notification bell icon so that you receive regular updates on upcoming videos in my channel. Until I meet you in the next video, stay happy, stay mommified.